Good evening. Myself, Dr. Santosh, welcome you all for today's Dr. K. Agarwal's Med Talks. It is the 621 episode on are probiotics is a good option in the treatment and prevention of urinary tract infection. We have an expert to discuss it further, Dr. Mrs. Alaka Godbole, MD obstetric and gynecologist, consultant obstetrician and gynecologist and laparoscopist. Welcome you, ma'am.
Hello.
Yes, ma'am.
Good
Yes.
evening, all of you.
Good evening, ma'am. Ma'am, one of the main questions is that what is urinary tract infection? Because for the understanding of our patient
Yeah,
also.
yeah. Firstly, just can I ask to share the screen, please? Share screen.
Yes, ma'am, it's coming.
Thank you. So today we'll talk about role of probiotics in urinary tract infections. So I think you asked me what is urinary tract infection. Next slide. So if we see what is urinary tract infection, it's an infection which is a bacterial infection which affects mostly whole urinary tract, including bladder, ureters, kidneys. And mainly it is due to E. coli, Klebsiella, Proteus, and Enterococcus. Generally, 70 to 95% of UTIs can be attributed to gram negative, that is E. coli. So, UTI happens when bacteria often go in the skin, from the skin or rectum, and they enter in urethra and infect the whole urinary tract. Mainly, first bladder infection, then kidney, and so on.
Yes, ma'am. So there is a risk of kidney infection also if you
Yeah.
neglect any urinary tract infection. So this is how the things comes. But here there is a people are asking like how much is a percentage, like whether I am susceptible to infection, or they are saying that whether male is more or female is more. So what is the prevalence or epidemiology rate of urinary tract infection in India?
Next, please. So, if we see urinary tract infections are more commonly seen in women, they usually
Yes.
occur between ages of 16 to 35. So, with 10% of women getting an infection yearly and more than 40 to 60% having infection at least once in their lives. And mainly we have seen that recurrences are very, very common in infections, these urinary infections mainly. These occur at least 4 times more frequently in females than males.
Okay,
Next.
that means that females are more
More
prone for
prone.
the
Yeah,
urinary.
yeah.
And female are usually coming regularly for your clinic because of the because they usually go to the gynecologist. They say that it is some pelvic related infection they come to you. So what is your in your clinic? How much percentage of your patient comes? Like every day, suppose 10%, 15%. What is the percentage? Like
Uh,
approximately.
it depends on season mainly.
Okay.
Not only as described here, as in young females, it can occur at any age.
Okay.
And as I'm a gynecologist, being a gynecologist, I see all females. So it's more common in females, but it is common in males also. It depends when the patient comes to you, because patient never comes to you, us immediately, because they try to have some home remedies. And after it is irresistible, then only they come. So in the next slide we'll see that.
Yes,
So
yes, yes.
that
What is yeah? You already discussed the risk factor. So
yeah.
definitely, what are the risk factor? What are the symptoms they come to your clinic, and what is the causative organisms mainly?
Generally, I can't see. This is very small, this slide. Can you just expand this? Because I can't see. I'm not able to see. Hello,
Pratik?
Mr. Pratik, can you make it little bigger font? Because it's very small.
Pratik?
Risk factors, as we have
Yeah.
described, that it is more common in females. There is history of UTI. Generally, after the sexual activity, these infections are seen. And in case of vaginal infections, also concomitant vaginal infections, diabetes, obesity, and there is genetic factor also in some patients with cystitis. If we see pyelonephritis, that is related to kidney mainly, there
Yes.
is a history of always diabetes mellitus, HIV, and then iatrogenic factors also, or congenital and acquired abnormalities of urodynamics.
Okay. So, ma'am, what is the clinical symptoms? Like, patient is, you told, just coming at the last stage. Like, what is the mainly clinical symptoms when
Yeah,
they come to you?
generally, patient comes with frequency and urgency of micturition.
Okay.
Generally, this is the always this that is dysuria. Or sometimes patient never complains about urine complaint, but she will complain about white discharge off and on. Then
Okay.
she can come up with fever, malaise, means body ache,
Yes. Yes. Yes.
chills,
Yes.
vomiting also sometimes,
Sometimes vomit.
nausea.
Yes. So that means this patient came at the very last stage where it is a spread of infection to the
Yeah,
female or.
generally there are so many pus cells. If we see in urine routine examination, we see so many pus cells, more than hundreds, and then only they see us, because before that, main causative organism is less intake of water,
Okay.
especially in this season, hot season, in May, October. There is a always chance that they will come with the urine infection, any age of the girl or premenopausal, postmenopausal, all ladies.
Yes. Yes. So that means what are the causes of UTI then?
So causes are what I have told, that cystitis and pyelonephritis. Cystitis means bladder infection and kidney and ureter infection. Next,
Yes.
please. So if we see, first and foremost is if the patient is catheterized, as patient always is in a hospital with history of operation, any small or major operation, so catheterization always induces urinary tract infection because of bad hygiene of the patient. That is a patient's error. But on the contrary, whenever we ask our staff to do catheterization after thorough cleaning of urethra. If that is not done, you are going to have infection inside. You are introducing the infection with the catheterization. So that is the main cause. Other causes are I what I told, like diabetes, other diseases. Mainly, I want to stress here, in some spinal cord injuries there is, because the patient is unable to micturate, so there is always chances of infection. And E. coli, which is a gram negative bacteria, that is the causative organism mainly in UTI. Others are not drinking enough water, what I have told just now, that is a less intake of water. So I always tell them, even if you tell any antibiotic, probiotic, any liquid urilizer, means alkalinating agents, because what happens in urine infection, urine becomes so much acidic, so it burns. So we have to give alkalizer, but with that, you have to drink a lot of water, more than sufficient, because we are losing it from the sweat and other things. So we have to drink lot of water. That is the main causative factor.
Yes, yes. That means there is a lot of causes are there for a urinary tract
Yeah, yeah.
infection,
There are many.
many causes, and
After
mainly
so
this.
many antibiotics, also there are infections because some antibiotics are not suitable to each and every individual.
Individuals. But in the right now, if I say because of the summer season and drinking
Yeah,
water is one of the
is
important,
one
if
of
I say
the
right,
is
yes,
main
yes,
culprit is season.
maybe, yes, maybe the culprit. So
Yeah,
especially like you can suggest our all the audience that of course drinking water is first thing they have to do before anything go ahead with this.
water, other liquids like sharbat and juice, anything, nariyal pani, everything is possible. We can
Yes.
have any type of liquid.
Yes. Then coming to the next factor, what are the risk factor? This is the cause of a causes, how the cause.
Yeah,
What
yeah.
which patient is a risk for the urinary tract infection?
So, as I have suggested that there are risk factors like anti-estrogenic, means then genetic, bacterial infections, then iatrogenic like catheter and all these, and main is use of steroids. Because of use of steroids and other drugs, it can cause urinary infection. Because even I always tell my patients that whenever you are taking any tablet, you drink more than enough water, not enough. Only one good, two the sips are not enough. You have to drink full glass of water. So it is a iatrogenic infection. Then bacterial, there are so many bacteria which can cause, which can enter because and main thing I wanted to tell you that why it is common in females, because female urethra is very short, so they are susceptible for infections frequently. So genetic, there are it cannot be explained as such, but there are genetic causes and I can't read it here.
Yes. Yes. This is a
Pregnancy.
Ma'am,
pregnancy.
ma'am,
Then
ma'am, you just have to
Huh?
maximize your screen. Ma'am, you just have to maximize your screen. On the screen, there's
I
option
will
of
do,
box.
but I'm worried that,
No,
huh?
no, no. Yes, now
No,
you can
no,
see.
no.
Click on the
Hmm.
ma'am, because this is the maximum size I can do from this side. You just have
Okay,
to, ma'am,
okay,
on
no
the
problem.
screen, there is a box. You just have to click on that box. Small
Yeah,
box is
yeah,
there.
I did it, but it's not working.
ma'am, that below USB there is a icon, side beside USB on your right side.
Please. Huh,
Ma'am,
huh,
there are three brands of Vipac
huh,
PS
huh,
and
huh.
USB. Just next to that, there is a box. You just have to
Okay,
click on that.
okay. Huh, yeah, yeah, yeah.
Yeah, you have to click
I'm
on.
doing
Yes.
on my this thing. Okay, I can read
Okay,
it
ma'am.
now, a little bit.
Okay, ma'am.
Okay.
Yes, ma'am.
Yes,
Oh,
yes, yes.
Huh.
Yeah. Yes, ma'am.
Okay,
Then
next.
we are discussing about the genetic and yes. So usually they said you told that patient will come at the last stage, but before that I want to understand what is the stages so that they will understand which stages they are and they have to come to the
I think
doctor.
it's in the next slide. Just
Yes.
next one. Huh. So if we see, there are 5 stages as such. In first stage, colonization of pathogens means there is an entry of pathogens inside the urethra. So it goes, urinary infection always goes from down to up, ulta, against gravity. So that is a stage one. It is a very mild dysuria or discomfort, I'll say. Then second stage, we can see uroepithelium penetration. That means if the patient doesn't see that she is having some problem, if she just neglects, then probably it goes to bladder.
Blood.
So, third stage is ascension. Bacteria ascends towards the kidney via ureter. Means once it is settled in bladder, that once there is cystitis, up to stage 2 there is cystitis. Then stage 3 is ureters are involved, and from ureters it goes to kidney. So stage 4 is pyelonephritis. That means infection goes to kidneys. And last stage, acute kidney injury also can occur if there is so much infection by some or other reason, as we have discussed. So there is bacteriuria which continues to cascade up to the kidneys, leading to acute kidney injury. And
Yes.
then the worry begins.
Worry begins. Actually, that is the last stage.
Yeah,
When they move to the kidney, it is very difficult to treat for you
yeah,
or for any other doctor. It is
yeah,
always
yeah.
so it is always better to come in stage 1 and 2. That's what you
Generally, patient comes in stage 2 or max to max stage 3.
3 Okay. So
Because
it is always
around stage 3 patient starts getting fever and all other symptoms, so
symptoms. Yes.
she comes.
Yes. So coming to the next one, that what are the already told about the symptoms, but what is the symptoms if it is a bladder infection or it is a kidney infection? So at least doctor will understand that stage 1 means what symptoms, stage 5 is what
Yeah,
symptoms. So
stage 1 or cystitis, stage 1 and 2 are cystitis. Generally that is a bladder
yes,
infection.
yes,
Generally in this we can see that patient complains of urgency of micturition, increased frequency, urgency is the main cause, and dysuria, that is painful in urination, and pain in pubic region. And if we do blood test and urine test, we can see bacteriuria in urine and WBC count rises above 11,000. And mainly cystitis is more common in women. But this is very right that 90% ladies are having cystitis. Even while doing clinically examination, means per vaginal examinations also we can see, we can feel that she is having, if we press it on the bladder on anteriorly, we put our fingers, whenever put our fingers in the vagina, always she will complain, oh doctor, it's paining. That means she is having mild cystitis at least. Then we have to confirm it. CBC and urine are basic investigations. And if it is ascending, means that is a severe infection, kidney infection, she will feel flank pain, high fever, malaise. And same WBC and bacteriuria we can see. And other urinary symptoms similar to cystitis. But mainly she will complain other things also, that I can have the sensation but the urine stops in between. That means she gives typical history of this thing, bladder stone or ureteric stone, that it urine cannot pass above that.
yes,
So
yes.
there is a chance that she might her kidney might be involved. So in this, sonography is must.
Yes. Coming to the next one, so what is the, because you told there is a chance of kidney stone and all, so what is the differential diagnosis? How to differentiate the other condition? And if that is the urinary tract infection, what
Yeah.
is the prognosis in future?
So we can do differential diagnosis only after, clinically we can see that it is a vaginitis or PID or renal stone. Also we cannot confirm. Only cystitis vaginitis is confirmed by clinically. So we have to do differential diagnosis in our mind. We have to keep that it can be a kidney infection, that is pyelonephritis, or it can be a stone, it can be due to vaginitis or PID. PID is most common in our patients. And herpes simplex, that is a very rare condition, but we can see so many times. So according to this, if we see the prognosis, that depends on the factors that indicate poor outlook. These factors are poor overall health, means whenever the patient is having some other also comorbidities or advanced age, or there are presence of renal calculi, or there is history of poorly controlled diabetes, or history of sickle cell anemia, presence of malignancy, and main thing is catheterization, history of catheterization, and history of ongoing chemotherapy. In this, more heat is generated in the body, so there are more chances of urinary infection. Then history of chronic diarrhea, and so on.
Yes. So then you told about differential diagnosis. What is the prognosis when it
Yeah.
is go to the bad prognosis? But in terms of diagnosis, because you told that there's a lot of reason, other causes also, which will mimic the same symptoms. But how to diagnose the UTI? Next, yes.
So main thing is there are so many types. Initially, we do dipstick test at in our clinics. So urine analysis is done by dip, dipstick urine cultures. Because of cultures, we can differentiate which type of bacteria, which antibiotic will be suitable for which infection. Then if it is not treated, means if it is not controlled by this, then we can advise cystoscopy. And before cystoscopy, I think this ultrasound is must. MRI comes late in picture because that is for severe infection which is not controlled, or the patient is under onco surgeon, or he is under radio taking radiotherapy or chemotherapy, like that. But mainly cystoscopy is the main thing is done nowadays. It can reveal so many things in trabeculation in the inside the bladder, so many infections, trigonitis, cystitis, everything is diagnosed by cystoscopy. And main thing is if there is stone, that can be cut by the lithotripsy machine and it can be taken out by the DJ stent and all these. These are the uh, urologist, this urologist does, but we have to know that what will happen, and we have to accordingly send our patient to the next, means urologist or surgeon.
Yes. So after the diagnosis, what is the management of the UTI?
Next. So in management, always acute UTI, we have to treat patients with antibiotics, and more than three times infections in 12 months, 3 to 4, we have to do refer them secondary care. That is what just now I told, that we have to refer them to urologist or onco. If it is something else, then oncosurgeon. But generally, we have to refer them urologist. Urologist does it cystoscopy, and if in cystoscopy it is normal, treat the abnormalities as such. What I have told just now, that if there is trabeculation or something else, the urologist does this. And if it is normal, because of after antibiotics, if nothing is there in cystoscopy, means if it is normal, then we call it that it is due to premenopause or postmenopause. So we offer them some other vaginal tablets and other things, and follow mainly.
Okay. Yes. Ma'am, in the next we say that there's a treatment like antibiotic you told. Coming to the probiotics, how it is going to help in this kind of patient?
So this is very good and important question, because only antibiotics is not the answer to treat anything like this. Antifungal antibiotics only, these are not helping the patient to cure fully. We have to give probiotics. The name probiotics means it is helping antibiotics to uh, repair the tissue. Main thing is treatment is always along with antibiotics. I always prescribe probiotics, and lifestyle and home remedies are okay. That increase water intake and cleanliness privately, cleanliness in the during menses and all this. But probiotics help a lot in curing UTI and anti and fungal infections also, and viral infections.
Yes. So what are the next, like what are the probiotics in treating the UTI which you feel it is important in your practice?
Next. So if we see, there are so many studies, there are so many probiotics, 6 type of probiotics are found. And these are different lactobacilli. Studies have shown that lactobacillus species comprise of 90% of the organisms which are present in the vaginal samples from women without urogenital disease condition. So 80 to 90% of these lactobacilli produce H2O2, mostly attribute to Lactobacillus cryptacus and Lactobacillus jensenii. There are so many like this, but Lactobacillus dominated vaginal microbiota is correlated with a healthy vaginal microenvironment. That means lactic acid is always there in vagina. Lactobacilli are always there, which are helping otherwise also. But we have, once there is infection, we have to enhance the uh, treatment. So we have to give these probiotics. Next one.
Yes. Then what about the streptococcus? Because all the four you just explained, like just
Yeah.
let.
So if we see a significant decrease of recurrence of infection in the probiotics containing streptococcus plus antibiotics group was observed in the Urinary tract infection.
Hello. Hello.
Sir, I think there's some issue from ma'am sides. Ma'am sides, the
Oh,
internet. Yeah, internet connectivity. She has lost. We will check in 2 minutes. We'll check.
okay. In the meantime, I will discuss the next one.
Yes, sir. Surely.
Yes, yes. You can stop sharing the screen. So I will just, of course, there is some technical issue there, but I will take it ahead. One thing is about the streptococcus, which doctor is discussing, that significant decrease in the recurrence of infection of probiotics which contain the streptococcus. So it is like they done many studies in this. It is clearly says that even with after 1 month or 3 months of follow up, there is a improvement in the infection, and that mainly the bacteria which secrete lactic acid, that is the lactobacillus and streptococcus, they believe to be a protective role against this pathogenesis. Then coming to the clostridiums, there's a clostridium lot of benefit to the body. We are interacting with intestine directly or indirectly, as of course you may have a lot of experience with the clostridium species in this. So microbiota play an important role from the initiation of LTI, and upper UTI is also more common with the lower urinary tract infection. So that's what they are saying, that it is a vaginal dysbiosis. There's a many study which say that vaginal dysbiosis may result in E. coli colonization and prompt recurrence of UTI. So maintenance of vaginal bacteria symbiotic relation is more important because of the proximity of the urethra and the vagina in the women. So there is a study that Clostridium bactericum he helps in the modulation of the gut succinate level, and also microbial, which is the one of the effective treatment related to gut dysbiosis. So that means that there is a gut dysbiosis and there is a urinary tract infection is associated, and any betterment of a symbiotic relation between the clostridial gut and the vaginal, it will helpful. Yes, we got yeah, Dr. Laka. Hello.
Hello.
Yes, ma'am. Ma'am, we are discussing.
Uh,
We are thinking about the clostridium. So now we
uh,
went to the
yeah,
Bacillus
yeah. Now
species.
he can because I can't see on my this thing. I can't.
Yes,
It's
yes, yes.
I'm unable to.
Yes, yes. Pratik,
I'm
can you
on
share?
my mobile now.
Yes, yes, yes. There is a discussion about the Bacillus
Sorry.
species because
Huh.
there is a lot of diversity in the microbial risk of urinary tract infection, and it will balance the gut flora towards the popular microbial population into the dysbiosis. Can we able to see the screen?
No, no,
No.
no.
Okay, okay, yes.
I'm unable
Then
to
it,
join. I don't know why.
yes, yes. Maybe there's a
Yeah,
technical
yeah,
error.
yeah.
This is the one of the
Now
problem.
at
Yes,
least.
yes.
Yeah, yeah,
Yes.
yeah.
Maybe you already
Lost.
discussed about the lactobacillus species, which like
Yeah,
probiotics
yeah,
restore the lactobacillus in vaginal flora, and it helps
yeah,
to restore the vaginal flora also. So in the study, lot of there is a relation between vaginal flora and urinary tract infection. This is
yeah,
the right according to
yeah, yeah. It is very
yes,
interrelated because the vaginal infection always goes to bladder. So there
bladder.
is
Yes,
always urinary infection. Whenever there is vaginal infection, we have to treat both.
both. Yes.
Ah,
And there may be the reason because of the women have more UTI infections, especially in a pregnancy and other hormonal compared to male because of these reasons.
yeah, there is less immunity. Immunity is
Yes,
depressed, suppressed. And
yes, yes,
even from the gut flora, also, there are chances of urine infection. So
yeah, yes, yes, uh,
always there are more chances in pregnancy.
yes. There are some questions because of
Ah,
time. I will definitely ask some 4 to 5 because of the time
okay.
constraint. In urinary tract infection, you go for blood test or which blood
Yeah,
test if you go ahead?
CBC,
Okay,
complete blood count, because we have to see white blood cell count. It always
okay,
increases in any infection, especially
okay,
in urine infection, it goes up to 16,000, 20,000, like that. Apart from
okay.
urine routine, because urine routine is a basic investigation.
Okay, okay. Another is what kind of antibiotics you usually prefer, and along with antibiotic, you start probiotics from the day one. And if that is there, what is the duration of probiotics in the antibiotic?
Uh, Generally, we give for 10 days. Antibiotics 10 days, and these also probiotic along with antibiotic. If we give antibiotic twice a day, we give probiotic once a day. That is the thing.
One, yes.
But yes,
One thing is
we
a yes,
always give probiotic
probiotic.
with
Uh,
antibiotic.
yes. Ma'am, any clinical experience you come across in this week or previous week, so that they will get clearly understand like what kind of a like whole story, like sign, symptom,
And
diagnosis, then
yeah,
treatment.
and apart from giving with antibiotic, even for vaginal infection, whenever we prescribe antifungal treatment, local and oral, we always try to give probiotic with that, because that helps a lot in
Yes.
having vaginal flora maintained.
Okay. And that is the antibacterial, antifungal, then probiotics. It is the kind of a
Yeah,
combination sometimes.
yeah,
Okay.
combination. Plus,
Yes.
main more amount of liquid orally. That is a
Okay. Yeah.
main
That is the,
suggestion for them.
yes. Yes. And then before the closing of this, I want your clinical experience and the final highlights for our audience. How to manage this urinary tract infection in common population.
Generally, generally we see, because this is a seasonal infection, because hardly we see in other seasons, especially in rainy season, there are very less infections. It's very less complaints about this urine. But especially in cold season, in winter and summer, it's more, because winter they never feel thirsty, so the patients drink less water. And especially in summer, they need more water, but they drink more, less than enough or enough water. And mainly, if they are taking any other antibiotics or any other medicine, even anti-inflammatory drugs, anything, they need to have more this thing. So you have to give them advice that increase your water intake, then give them mild antibiotic, amoxicillin. Always start with amoxicillin. I never start with higher antibiotic because for each and every patient we cannot do urine culture and it's not necessary also. And it takes 8 days, minimum 1 week. So by that time, that infection becomes severe. So mainly I start with an amoxicillin. Then if it is not treated with that, then we advise them to give urine for culture and sensitivity. And according to sensitivity, we advise antibiotics and main thing probiotics with them. We have to give probiotics with each and every antibiotic so that the vaginal flora is maintained and lactobacilli are there, so they help in healing urine infection. They lessen the infection mainly. Instead of giving only alkalizing agents like other liquids, means it's a necessary thing nowadays that probiotics should be given to each and every patient of UTI. I think even
Yes.
urologists are doing the same. They are advising and probiotics. But in those patients, male patients, generally fungal infection is less. So, in what happens in ladies, there is fungal infection along with many a times 80% patients have fungal infection. So, probiotics help in that way also to heal.
Yes, yeah. It is like clearly summarized that it will reduce, probiotic will reduce the risk of recurrent
Risk.
UTI along
And
with when you are,
it
yes,
reduces the risk of upgoing infection to kidney.
infect.
We have to
Yes,
have a check on that. So it is a
yes,
must.
yes. So it has like it will stop the stage 1 to stage 5
Yeah, yeah,
prognosis also, and of course that it will restore the vaginal flora and it will help to reduce it
yeah, yeah,
and you already told that when you are using the antimicrobe, antifungal or antibacterial, so it is using probiotic will help to reduce the GI disturbance or it will
yeah,
adherence is much better. That's what you are saying. And
yeah,
it is
yeah,
of course. And of course, you said about the safety profile also because it doesn't have any other side effect along. Of course, it is
yeah, yeah,
added benefit compare when you are adding with
yeah.
different
Sure.
way. Yes, ma'am. Yeah. Thank you. Thank you for giving the nice overview about how to manage the urinary tract infection with the probiotics and how to prevent it. That is more important. Like management is treatment is different, but as you rightly said,
Yeah,
recurrence is most common. And how to prevent this recurrence with this probiotics? It will. I thank Dr. Mrs. Alaka Godbole for having a nice conversation with us for this. Thank you, ma'am. Thank on behalf of IJCP, I thanks you, and it is our semi grant, and this program is sponsored by USC Private Limited, maker of YBAC and YBAC DSM. Thank you, ma'am. Thank you.
thank you, thank you.